I have been researching this bioidentical hormone specialty for years. I'm one of 8 children. I have 2 brothers that were adamant that when I started going through the change, as they used to call it, that I was not going to take the chemical-based hormone replacements. And so I've been reading this stuff for 10 years. When I found out what they were doing here, and I started asking my questions when I called and spoke to Ray and Laurie on the phone, they were so wonderful, and it just sounded like it was a no-brainer. I had to at least come in for the first initial visit. I did things a little differently too. Since I knew so much about it, I went ahead and got my blood work done, so that when I walked in the door, I pretty much had everything that they were looking for already tested and ready to go, so that I could immediately get help. So I walked in, met with Juanita. She was fabulous. She spent about 45 minutes to an hour with me going over my blood work. She put together a plan. And one of the beautiful things I think about what they do here is they encourage you to follow along. Juanita made me a copy of all my blood work. She gave me a pencil and a pen and made sure that I wrote down and took notes as I went along with her, so that when I left there, I could remember what we discussed. Because one of the things that I'd been having difficulty with remembering. My short-term memory was horrible, and that's all part of this whole bioidentical hormone issues that so many women have. Some of the things that I noticed right away was my vision got to be clearer and clearer. I was sleeping finally for 8 hours. I mean, what a relief that is. I was a kinder, gentler person when I slept. I have an older brother and a younger sister, and I was home visiting my mom. And I was getting ready to leave, waiting for my brother to come pick me up at my mom's, and my sister's sitting there talking to me, and she's going, so what are you taking? And I'm like, what do you mean, what am I taking? And she says, you know, like, what drugs does the doctor have you on? And I went, natural progesterone, thyroid, B12, you know, rattled off a few. Oh, okay. So I was like, that was kind of weird. So I don't think too much more about it. I get my bags, I go out, meet my brother. We're driving to the airport, and he says to me, so what drugs are you on? And I'm like, okay, something really weird going on here. Well, here apparently the 2 of them had gotten their heads together, and they had decided that because I was so calm, so easygoing, sleeping 8 hours, and I was not erratic or crazy or anything else, that I had to be on Xanax or Zoloft, you know, one of the big Z's, because I couldn't possibly be this calm without being on some kind of medication. And when they found out that it was all natural, they were shocked and awed. I mean, totally surprised. So my mom and I got the biggest charge out of it. So, and it's, you know, siblings who really don't pay attention to any of this stuff. But that was a rude awakening for them, because they realized that you don't have to be on drugs to feel better.